Welcome to Lifestyle Med with Dr. Jade. Health, it's a lifestyle. Hey family, and welcome back to Lifestyle Med with Dr. Jade. I'm so excited to film this day in a life of a family medicine resident clinic day. You guys really enjoyed my day in a life video where you followed me on a specialty clinic day where I had procedure clinic in the morning and HIV clinic in the afternoon. But today we're just going to do a traditional family medicine clinic day where I have a full day of clinic, and I wanted to show you what that looks like specifically in a resident clinic because I'm in my last 6 months of residency, and I wanted to show you the difference between how this looks here versus how it will look when I open my practice, Inspire Primary Care, after residency coming to Las Vegas in January. So I'll be showing you how that looks throughout the day, kind of between patients and after clinic and things like that, so you can get an idea of how that looks. Something I love so much about being a family medicine doctor is that I get to take care of the whole family. I get to take care of chronic diseases, things like diabetes and high blood pressure. I get to talk to my patients about health and wellness and lifestyle and weight management. And I also get to do urgent visits, urgent care type of visits where we talk about, an acute thing that has happened recently, that one specific thing that a patient may want to take care of. And I get to see kids and pregnant patients and, and teens and women's health, men's health. I get to do procedures. To me, it's just so awesome because every day you don't know what you're gonna get. And it's a mix, and it keeps me on my toes, and it keeps me looking at guidelines. I love that. A quick thing I wanted to tell you about the difference between a resident clinic and what clinic will look like once I'm done with residency in 6 months. In a resident clinic, we have supervising physicians. So family medicine residency is a 3-year training. After you graduate medical school, you do 3 years of residency where you're a new doctor, you're a physician, but you're being supervised by a more senior physician who has completed residency. So for 3 years during our clinic, after each patient, we go to our attending physician or our supervising physician, briefly tell them about the patient and what we plan to do, and then they either agree or they help us come up with a different plan if they would have done something different. And we do that for each patient. So that's the main difference between a resident clinic. After residency, you don't do that. You don't ask anybody or run your plan by anybody. You just see each patient without that extra layer of supervision. So that's the difference between resident clinic versus what it will look like when I'm done with residency. So yeah, let me take you on the day with me. Hope you guys enjoy this. If you want to see more videos like this, let me know below. If you like this video, please hit the like button down below, subscribe, share this video with other people that you think would be interested in learning more about what life as a doctor is like. Okay, let's go, guys. Okay, family, so I just finished my first visit. My first visit of the day was a video visit. Things I did when I came in, I looked at the board. They have a whiteboard that shows all the residents' names and and what attending or supervising physician each resident is assigned to chief to, we call it, or report each patient to between patients. So I looked at the whiteboard, I saw which attending physician I'm assigned to. I printed off my schedule for the day, took a look at my full schedule. Also, I look at the board to see which MA or medical assistant I'm assigned to for the day, who's going to be rooming my patients and doing the vitals, things like that. So I said hello to my MA. We chatted about what our patient list looks like for the day. And then she told me that our first patient was roomed. So I'm in the room now because it's my first one's, like I said, a virtual or video visit. I just got off the computer with the patient, and now I'm gonna go to my supervising or attending physician, let them know what plan I have for this patient, and we'll move from there. And then the supervising physician will say hello to the patient, make sure all their questions were answered, and I'll move on to the next patient. So my first patient of the day was a urgent or a same day appointment, which is like an urgent care appointment where they have one new thing that they want to chat about, and we'll see what the next patients bring. It looks like we have a nice mix today. We have some OB patients, some prenatal care that we'll do today in the clinic. We have some chronic patients that I see often for their more, things like diabetes, high blood pressure. They're more chronic chronic things, and I do see some kiddos on my list today too. So we have a nice mix of everything today, and that's the beauty of family medicine. So let me go chief this patient and come back, and then we'll head to the next patient. All right, bye. All right, family, so I just finished a visit with one of our OB patients, our prenatal visit. So that was super fun. It was great because we got to talk about birth plans and, you know, all the things to expect during labor. And a great part of residency for family medicine training is that we do get to do prenatal low risk OB obstetrics care, and we get to deliver babies. I don't plan to continue my prenatal training after, or I should say my obstetrics training after residency, but it's great to be able to deliver babies and see pregnant patients in clinic during my training. It's one of the many joys of my residency training. However, because of lifestyle and things like that, I don't want to have to be able to like go back and forth delivering babies once I'm done with residency. But so that was a super fun visit. And now I'm about to do a telephone visit and call up one of my patients. My nurse already roomed her, so I'm gonna call this patient up and see what we're gonna chat about today. All right, so we're back. I just am wrapping up the last patient from my morning clinic. I had a few no-shows this morning, so I saw 6 patients this morning. I have 10 patients scheduled for the afternoon. I'm gonna finish up with this last telephone visit now. This is an urgent care, like same day visit. I just finished. I had several things after the OB or prenatal visit. A few other patients that were more of like your typical chronic disease type of visits where we address like diabetes and high blood pressure and medication management, things like that. So I had some of those visits, some good follow-up on those. And now I'll finish this last visit before then I'll do all the like paperwork that needs to be done for you know, like ordering prescriptions, things like that. I also have this portal where patients can like message me where they need refills. Pharmacies message me when they need refills. So during my lunch break, I kind of do some of those things as well, like some of the paperwork aspects. That way I don't have to do them after hours, and answer any patient questions that may have come in through my portal as well. So just some of those like logistic stuff that I'll probably do half of my lunch break, answering patient stuff and answering pharmacy refills and things like that. And then I might try to eat really quick before afternoon clinic starts. Okay, here we go. Hey family, I just finished my clinic day. Afternoon clinic was super busy, so I did not get a chance to film any of it. It was just so many patients packed back to back. I think I saw 10 patients this afternoon, so it was just kind of run one room to the next. So kind of busy there at the end. I'm pretty tired now just because it was a really busy afternoon, but I'm happy to be done. It is now 5:48, so I stayed for about 30 minutes after and finished my notes, finished answering any patient emails or pharmacy questions that were sent to me, and now I'm able to go home and not have to take any work home. So headed to get baby girl from clinic. Gonna cook some dinner and wind down with the family. And I hope you guys enjoyed this clinic day. This is what a day in the life of a family medicine clinic day looks like. There's so many things we see each day, which is why I love family medicine. And if you are in the Las Vegas area, I will be opening my direct primary care membership-based practice in my hometown in Las Vegas, Inspire Primary Care, which will be amazing, and that is coming January 2022. So I look forward to treating my home community with quality, affordable, and accessible healthcare. And so let me know below if you'd like to see more videos like this. I hope you guys enjoyed this. Bye. Be sure to like, comment, share, and subscribe. Thank you, and God bless.